I think I eventually woke up on my birthday, which was 17th May.
I didn't have treatment just in QE, but in 4 different hospitals. I'll never be able to overcome what I've gone through.
I think one nurse slid down the wall and collapsed.
From this evening, I must give the British people a very simple instruction. You must stay at home.
Did I do the right thing? Did I give her the reassurance that she needed at that time?
Whilst I wasn't at QE at the time when COVID-19 first arrived into the UK, I was on the Isle of Wight and I was the chief nurse. Many of us lost colleagues, family, friends and patients, and it was hard. There's no two ways about it. But what I do think it did is brought the spirit of working together in the NHS, but more importantly, what I've seen as I came to QE at the end of COVID was just what an amazing team QEH is. So I hope you, like me, will take a moment just to reflect on what a difficult period of time it was, but just how much it made us think about the benefits of what we've got as Team QEH. Thank you.
I think when you go back and you think about it, unpredictable, scary, being scared of the unknown. From a matron perspective, it was really thinking about not only about the staff, about the patients that were coming in, but also of my own family. And I think everybody was very fearful of the unknown.
We were having a really busy day, like most days. We had a gentleman that needed to come in. We needed to admit him. And we'd got him a bed on one of our wards. I took a call from ED to say that the gentleman's wife had just called and they'd just got back from a cruise and they'd just had notification from the cruise company that there'd been some positive COVID cases on the ship. And then it turned out that he was our first positive case and he was the first positive case in Norfolk.
We've got a patient with a highly suspicious COVID-19, obviously it was new at the time. Our staff hadn't all had the training with the FFP3 mask and that was a necessity at the time. So we had to find a member of staff who would be the nurse who would care for that patient, and that was another member of staff for another ward, and she was petrified as well. But it ran quite well on that one day. Like I said, that was going to be the only patient that we was going to have. That quickly changed.
So my name's Toya Greenall and my role at the beginning of the pandemic was infection prevention and control support worker. We weren't really prepared as much as we thought we would be for something as big as this. It then came down to pressures around equipment and making sure we had the right protective equipment for the staff. So along the first kind of few weeks, we were really feeling our way as to what the needs and pressures were going to be moving forward.
I think we understood that because it was spreading quite fast and we were seeing a lot of people getting affected every day. So we knew it was just spreading very fast and it was really bad.
The number of patients who came in, very poorly patients, they're intubated, sedated, it has really the numbers has really doubled, yeah. And then you can see the whole unit from this end to that end is closed, everyone's on full PPE. And we've got the green zone in recovery where we have to look after patients who are non-COVID at that time.
One of the biggest things we had to do was to have a venue big enough where we could educate all of our staff to upskill them, was allowing for social distancing in a venue that was big enough to educate 30 people at any given time. So we ended up moving all of our education resources to the town hall where we were stationed there for a period of weeks to allow us to deliver education.
As time went on, we had to make sure that not only were we making sure that staff were protecting themselves properly, we had to make sure that all areas were aware of what they needed to do their bit.
So, we offer a lot of reassurance to our women with smiling and all that sort of things. They couldn't see that, so we had to sort of think, how we were verbally speaking to our ladies and just giving that positive reassurance in our voice rather than just in our facial expressions as well. So that was really difficult to come across to begin with, until we sort of got into the habit of doing it and saying, you know, we are smiling behind our masks here, and sort of giving them that reassurance.
We normally would have 2 birthing partners in a delivery room, but we had to drop to 1 birthing partner only because of the visiting restrictions, which obviously for the majority of women wasn't really what they would have chosen.
And things like going for scans on their own as well, you know, and not everything was, you know, a happy outcome for the ladies. So to have to go to that scan on their own had a huge impact for our ladies out there.
I was working in Denver as a staff nurse in 2020, and unfortunately I contracted COVID, and I had to be shifted to ITU and put on a ventilator, you know, for saving me, because I was very poorly. And I never ever thought that I would be back to normal, or I would be able to survive this dreadful disease. And I woke up in Papworth Hospital after 28 days of induced coma, and I woke up on my birthday. And I thought for a second I'm in heaven, because I like I said, I already gave up, and maybe somewhere back down the lane I was ready to go. But there's a nice whisper in my ears with a lovely staff nurse saying, "Oh, Jenny, you're doing brilliant, don't worry, you're in Papworth Hospital." And that's when I understood that I'm alive, I've survived, and I'm in Papworth.
So the week before, I had that sixth sense where something wasn't actually quite right, so I went for my COVID test, as it was mandatory in them days. Spoke to the ex-wife at the time and said to her, "Look, unfortunately I've got COVID, so I'm going to shut myself away in my room." And the Monday you can literally write off as a blip. I don't remember much on Monday, apart from sort of like getting up and down to the toilet every now and then. I was blue lighted into the red ED department, which was the Arthur Levin. Wonderful staff in there, absolutely brilliant. And then I got whisked from there up to Necton Ward, moved a couple of times, and then I got transferred into the ITU. I was then put into an induced coma. I think I eventually woke up on my birthday, which was 17th of May.
You know, when I woke up, to be honest, from the medically induced coma, after a very long sleep, if I may say, I thought my battle was over. But to be honest, that's when the battle started. And like I said, I woke up on my birthday, and it felt like a rebirth, because I had to learn how to walk again, learn how to talk again, basically learn how to do everything again from scratch. It was like, is my life going to be this same? Oh, I'm sorry. I thought I wouldn't cry, but it took a huge toll on my emotional well-being. I was like, oh God, I hope my daughter remembers me, because 3 months is a huge gap. And I thought, that's it. She won't remember me. She won't recognize who her mother is. There's a lot going on. And to be honest, if I could say in one word, COVID-19 did not just test my body, but it did test my will to survive.
It was absolutely fantastic to receive the care that you actually get. And you just see, from sitting down, or laying down in my case, how much hard work they do actually do. And they are very, very much overworked.
I think one day when we didn't leave the unit until we had to go out, so we had to go and don and doff in there, and then we went out. I think one nurse slid down the wall and collapsed, dehydration, and seeing the nurses, how professional they are, crumble. That was hard.
We used to talk about how awful it must be for the people's families who was in here with COVID. You know, especially the time where people couldn't come in. And you just think of yourself in that situation and think how horrific it must be for them.
I have to be honest, for me, it felt very special because I was an inpatient right at the beginning of the pandemic. So couldn't have visitors, didn't have communication, and for a day I didn't have a phone, and I've never felt so isolated in all my life. So knowing as a family liaison officer that I could actually be someone who could change that for other people was wonderful, was really nice.
Critical care rang up and said, can you speak to this particular patient? And this particular patient was a young woman with breathing difficulties who had caught COVID, and at that time the only treatment really for her was to be put on the breathing machines that she needed in order to force the air in and out of her lungs. And she was so scared. I'd never heard fear like it when I spoke to her on the phone, and she was a person of faith. And so I tried to give her a reassurance as much as I could over the phone, because she was in hot critical care. And she, so scared. And I then prayed with her. And then immediately after that, she was then put onto that machine. 3 days later, that lady died. And whilst it was the right thing to do, and whilst the medical decision was the right thing to do at that time, there's always still a part of me that thinks to myself, did I do the right thing? Did I give her the reassurance that she needed at that time? Am I complicit in her death, for want of a better expression?
I'm Dr. Will Bratby. I'm one of the clinical psychologists in the health psychology department. When the pandemic hit, there was a lot of unknowns, there was a lot of changes, there was a lot of feeling out of control for people, all of which are very difficult from a psychological angle. In the clinical areas, it was the sharp end, I think, but that's not to say that it didn't affect everybody in the hospital. Of course it did. And so I was seeing people sometimes who were in the difficult situations, but I was also seeing people that might have seen it or even heard of it. Everybody had their own stresses, and everybody was going through the same pandemic as well. And whilst the rest of the world was closing down, the opposite was happening, I think, here.
It is very raw. One thing I've realized is I'll never be able to get over it or move on, but I think I've learned to live with it. If I may put it that way, because I'll never be able to overcome what I've gone through, but I think I'm learning to live with the fact.
We are proud that we have managed to go through that. We have fought well. Mm-hmm. We are over it, and just hoping that we don't see anything like this anymore. Yeah, just praying.
I think the fact that we all got through it really is quite a big thing, because, you know, a big part of the job that we do is working together as a team, and supporting each other makes a big difference to our daily lives.
The part that really gets me, even after all this time, is when my boy hugged me. I think I'm more determined to actually help a lot more people as much as possible. And you can sometimes see the fear in people's eyes and their body language. And if you just talk to them and just explain what's actually happening in the terms that they understand, then it just makes them feel a little bit at ease.
I think COVID sits, and some of the memories sit with a lot of our staff, and a lot of them are still struggling with that care delivery and the things they were exposed to during that difficult time. But the absolute importance of those small gestures that are actually small to us but hugely significant to patients and loved ones, and the toll that can take on us as staff as well.
We were, when we still are, such a tight group, and we just help each other, don't we?
We do, yeah. If we can help anybody, we do it, and vice versa. They would help us.
whatever like challenge will be thrown to IT, will be able to like overcome it, because we've been, I think the pandemic itself made the unit or the team very resilient. So I think, with the dedication and compassion, we'll be able to like overcome those challenges,
So that is my personal journey, starting from obviously when I was actually having COVID, all the way through to my recovery, and respect also for the place I actually work up and down the country as well.
I think the general public are probably fairly aware of how staff responded. It was very visual during that time, as much as it could be, and certainly has been since. But I guess it's around that staff putting themselves into challenging, difficult personal and professional situations and going above and beyond.